Awesome. Looks like it started.
Yeah.
All right. Hi, everyone. We've opened up the webinar a couple of minutes early, so we'll just sit here and wait till 1 o'clock to get started and let a few more people in. And yeah, thanks for joining us. And yeah, really looking forward to this one. So speak to you in a moment. And we've got a hello in the chat to let us know that you can hear us. That's appreciated. Thank you. Okay, we've just ticked over 1 o'clock. So welcome to the first Digital Health ECR Community webinar for 2022. For those who don't know me, I'm Dr. Brad Ridout. I'm a Senior Research Fellow with the Cyber Psychology Research Group in SOMS. And I'm very excited about today's webinar topic, which is something that touches us all, how to respond to reviewers. So before we begin proceedings, I'd like to acknowledge and pay respect to the traditional owners of the land on which the University of Sydney is built, the Gadigal of the Eora Nation, and recognise that sovereignty has never been ceded. I also want to acknowledge the traditional custodians of the various lands from which you're tuning in from, and welcome any Aboriginal and Torres Strait Islanders present today. So we've got a huge turnout today. So before I introduce our very special guest speaker, I just wanted to say welcome to anyone who has joined the Digital Health ECR community recently. We've had a member drive recently, so welcome. And if you aren't already a member, we strongly encourage you to whip out your phone and scan the code here. We're an informal group that brings together emerging researchers and HDR students with an interest in digital health research from across the entire university, which I'm sure members will agree is a great community to be a part of, given how diverse digital health is as a field and how dispersed many of us are across the university. So it's great to have a central place to all come together and network. Adiola Bamboji Ayadili and Katrina Pryor have recently taken over as co-chairs of the community from Anna Jansen and myself. And together with an enthusiastic new working group, have already come up with some great new events for the year. So keep your eye on the community newsletter and follow us on Twitter. Now, we're very lucky to be joined today by Professor Julie Redfern, who is here to share her wealth of knowledge and experience regarding how to respond to reviewers. So Julie is a Professor of Public Health and Research Academic Director for Research and Development, Output and Impact in the Faculty of Medicine and Health. Julie has received numerous awards, including the 2022 New South Wales Woman of Excellence, Vice Chancellor Award for Leadership and Mentoring in 2021, and currently holds an NHMRC Investigator Leadership Grant. So if you think of any questions for Julie during her presentation, please feel free to post them in the Q&A chat down the bottom of the Zoom. There's a button there. And yeah, we'll have some time at the end to go through as many of those as we can. So without further ado, please welcome Julie.
Okay, thanks, Brad. Thanks for having me. And sorry, I've got a bit of a funny voice, so don't mind my voice, but how exciting to see so many people online. I got some pretty easygoing slides, I think, and just my advice, but you know, please put questions in the chat. I'm here. You know, you have some of my time, so I'm very happy to use that and try and answer some of your questions. So please don't be shy to ask questions. So I'll share my screen and we'll go on with it. Is that all good? Yep. Okay, so please, feel free to tweet. I think there's lots of tweets already. Interesting topic, responding to peer review. And I was just talking to the team before saying I have done, I think, a couple of talks on being a peer reviewer, including to the CPC EMCR group and various other groups. But this one, they've asked me to speak about how do you respond to the peer review. So similar topic, but different angles. So I'm just going to share a few things, and another challenge was what the team has asked me to speak about. I think I just wanted to tell you I have been an editor on a number of journals, currently one of the senior editors on Heart, Lung and Circulation, which is a cardiology journal, but also on one of the Nature journals, Digital Medicine, which is actually the #1, in case you didn't know, ranked journal in digital health in the world at the moment. So look that one up. I'm one of the editors, or write to me if you have a paper that you think might be suitable. I think it's got an impact factor of about 11.5. But the other thing I think that's relevant is I've been an applicant. I have received and responded to a lot of peer review. I've published 200 papers, but I've also sat on over 30, Cat 1's grant panels. So been on the end of giving the feedback. So I've got experience on both of those sides. So let's see if that helps you out in any way. I mean, I didn't get to have something like this when I was learning, or still am learning, I guess. So the team has given me a really big challenge, because I'm not sure whether they realize, but responding to feedback peer review on a manuscript is a completely different ball game to thinking about feedback on a grant. So I don't know whether they really wanted me to do both, but I'm going to touch on both. They're very different with different things to think about. So anyway, we can raise those things in the questions. I should also say this is just my advice, thoughts and perspectives. There's no right answer to any of this. So please don't go away, but Julie said whatever. I mean, this is just for you to take on and think what may or may not work for you. So first of all, manuscripts. What is peer review in terms of manuscripts, and why is it important? And I think this is fundamental to the difference in the two elements I need to focus on. So when you're a peer reviewer and you're reviewing a manuscript, you're evaluating the work by one or more other people, i.e. yourselves if you're authors, and hopefully you have similar competencies to the producers of that work. So hopefully you've got some experience in the area. Importantly, I predominantly work in cardiovascular health and also digital health. But that doesn't mean, but I'm also experiencing clinical trials and systematic reviews. So it doesn't mean I can't peer review a systematic review in breast cancer, for example, because I know the methodology, and there may be other people reviewing the papers more experienced in the content. So you don't own, as long as you've got similar competencies in various areas. But this is the crunch here. And you might not like me saying this, but peer review of a manuscript does not serve to help the author get their manuscript published. Sorry for the bad news. The purpose of peer review, as it was introduced historically and still today, is to ensure the scientific quality of things that are getting out there in scientific journals are getting out into the public domain. That is what peer review is fundamentally about. And I think that is key to the thinking that you need to have here. And although it's all very nice to be people, and we want people to be very nice, we want reviewers to be very nice, it's not actually their job to be nice to help you get that paper published. Their job is to determine, is this good, is this unbiased, is this good quality, is this going to be helpful, is this meaningful, has it already been done before? These are the kind of things the peer reviewer should be looking for. And then they need to critique those areas. So if they think your paper is biased, but it overall is good and in an important area, then they might give feedback about how to, perhaps make it less biased or to address that bias. And that's your responsibility to try and handle that. in order to make your manuscript less biased, as it were. Anyway, we'll come back to that, but I think that's fundamental point and can be challenging and not necessarily what you're all hoping to hear today. So when you're a peer reviewer and as an editor, we're actually looking to the peer reviewers for advice, as I said, about, is it informative? Is it important? Is it novel? Does it add to the knowledge? Is there scientific quality, and is there bias, and is it ethical? And these are the key points that reviewers need to think about. So flipping that almost completely, what about grant peer review, and why is that important? So this is very different again. So grant review is a process by which applications are scored and ranked and given to the funding bodies, because sadly, as we all know, there's not enough money to go around. So somehow it's a bit like, I guess, in the high school certificate, there's an ATAR. That's how universities decide who's going to get into different courses. The funding bodies only have so much money to give out. If they could give more, I'm sure they would. And if they could fund all of the good ones, I'm sure they would, but they can't almost always, not always, but almost always. So therefore, they need some independent people giving them some sort of system to score and rank those applications so they can decide where they might fund it. So very different again. So you're peer reviewing for the funding body to get ideas about who is perceived to be better than the other. Not always the case, of course. So in this case, reviewers have to score against very specific criteria. And I'm sure you are all hopefully familiar with those types of things. And, you know, reviewers have to understand what the person's doing, why, again, the scientific quality, potential impact, significance, capability, and whatever the criteria might be. Now, some schemes do offer feedback to applicants, and that varies across schemes, and we'll come back to that. Some don't, and it takes a lot of time to give feedback. So I guess there's capacity issues and all of that. But anyway, it's not, sometimes schemes are designed to give you feedback and then help improve and take it on and move forward. And the New South Wales Health TRGS is one example of that, where you if you sort of make the sort of next round, you get an opportunity to do feedback, or the old NH and MRC project grant scheme where you could respond to feedback. But I think increasingly in Australia, in any case, there's not necessarily opportunity to respond to feedback within the same call. You may be able to do that for the next call, but we'll come back to that. So again, the reviewers really aren't there to help you get the grant. They're there to score and tell the funder. That's not to be said that there can't be feedback that's very helpful. So I just wanted to, I'm going to come back to it with an example, but I just wanted to say, like, I mean, I've just been a reviewer for investigator grants, and we have to do some written feedback, a small amount. And I will admit, you try, well, I try anyway, to be a bit positive and be a bit constructive. But also I do try to be a bit honest. So there'll be some of my feedback some people will like, and some of them won't like what I had to say because they won't agree with me or whatever reason. But I'm actually trying to tell them that, because that was one of the issues for me that made me score, you know, lower than I might otherwise. So I'm trying to be honest. It's no good just being nice and all lovey-dovey in the feedback, because then they won't understand why I've given them a 4 or a 3 or whatever I've given them if it's the lowest score. So the other thing I'm going to touch on is it can be challenging, particularly grant peer review, as we know, but we need to try and be resilient and open to it, which I'm going to come back to. So I'm just going to try and tackle the papers and the grants in 2 chunks now moving forward. Probably best to put your questions in the chat so that we can all come back, because hopefully we'll have about half an hour or so. So when you think about manuscripts, I'm not sure whether you know this, maybe you do, maybe it's obvious, maybe it's not, but pretty much editors have 4 options generally in terms of a manuscript. They can either just outright accept it, which I'll admit I don't think I've ever seen in my whole entire career, but it's possible. So they might accept it with 0 changes. They can accept it with minor changes. And the Nature journal I'm on doesn't tell the author whether it's major or minor, but the Heart, Lung and Circulation I'm on does. So you don't always know whether it's minor or major, but as an editor, you're thinking, is this minor things? or major things. And normally the minor things, once the author, addresses those, you're kind of pretty comfortable. As long as they address those reasonably well, you'll pretty much decide yourself to accept it generally. Major changes, not so much so. You'll normally be expecting quite a, bit more work, and you'll generally send that back to those reviewers to see if those reviewers are happy. And then you may even get further rounds and then move to minor changes after that. But I guess, and then you can outright reject it. So we can reject it, the lead editor, or at my level of the editor, you can reject it as well. And, a journal like the Nature one that I'm on, the digital health, we're getting so many manuscripts, we have to reject a lot of them. So the bar is getting raised, I think, by the month. So if you didn't know that, very basic thing, but actually quite important to sort of understand. The other thing I probably should say is a good way to get good at this is to actually be a reviewer, and then see what it's like to do a review and how hard it actually is. So I think offering your time to be a reviewer is good. If you've got an opportunity to help with any editorial responsibility is good as well. So I've got a few, really just a few tips on responding to manuscript peer review. And the first thing, this is kind of how I do it, and how I would kind of teach people to do it. But as I said, everyone can do it a bit differently. I tend to first sort of open the feedback, and I kind of see if there is feedback, even if it's extensive. And then, usually even if there is feedback, it's pretty good news. I think once you get even to major revisions, you've got a pretty good chance. There's no guarantee, but I think you're above 50%, probably 60, 70% chance, depending on the journal, that you might get accepted. So it's actually, even if it feels a lot and you've got 5 reviewers, it's actually pretty good news if you get feedback. Unfortunately, you can also get no feedback and rejection, which is tough and a different scenario. So typically what I'll do, whether it's a lot or a little bit, I'll get a Word document going, copy those comments into a Word doc, try and sort of step back from it and not leap too much into it with too much emotion. Then I start to work through that feedback. And this goes for very complex ones as very simple ones. And I'll typically try to just tick off the simple ones myself. The spelling mistakes, missed a word here, something is a limitation that I've missed, very simple things, and I'll just tick them off and propose how I would deal with those things. I then tend to share that draft response with my co-authors and maybe have discussions with some of them if I need to. What do you think about this one or this one? I might put comment boxes in there of things that I'm not sure of, or highlight things yellow that I need help with that I'm unsure of. And obviously, then that's okay. It's a team effort after that, and then we work together. So I then get that information together in my head and start to put together the more complicated answers in a more comprehensive response. So, and then there might still be a few sticking points. There might be 2 or 3 left. Still don't know how to deal with it. And I might get further input. I'll give you an example of that in a minute. Might reach out to someone else and I'll give you the example, but it might be a statistician, which I'm going to show you in a minute. Or you might have some qualitative things that maybe you didn't get it quite right and you had a qualitative researcher as your reviewer, for example. Well, it's fine. You reach out to someone, you try to get some input and some advice from an expert in the area. You can ask for their thoughts. You might have to do further analyses and things like that. That's when you're getting into the major revision. Once I've kind of sorted all of that out, my tactics, and really worked out how I'm going to handle it, it's only then that I actually start working on the manuscript, pretty much, unless I might have done some of the minor changes. But I pretty much plan my strategy and how I'm going to handle it before I do anything to the manuscript. Otherwise, it throws everything out. So I'll then start working through those things one by one. Sometimes I'll even make all of those points, highlight them yellow, and as I get them into the manuscript, I unhighlight them or make them green or something, so I know which ones I've done and which ones I haven't done in the manuscript. And then I don't usually finalize, what page or line, those things are on until the very end. So I'll leave those maybe highlighted as well. Try to manage my time. And I think this is quite an important issue. I think if the comments are pretty straightforward and you think it might be in that minor revision bucket, I think typically the strategy is to try and turn it around as quickly as you possibly can. it's a good look if you get it back in quickly, because it shows you're onto it, you've done it, fixed it, and the editor has it fresh in their mind. So tactically, you don't have to. Tactically, though, if you can, that's good. But equally, if it's very complicated, and I'm going to explain an example in my team recently, if you need more time, take more time. Ask for an extension if you need to. One thing I don't encourage people to do, it's perfectly acceptable, but it's not my suggested strategy, is they say you might get the feedback back today, and then they say it's due the 1st of August. I wouldn't work to like a grant, getting it in, on the morning of the 1st of August. I would be always trying to turn it over as quickly as possible, unless it was complex and I needed more time. So that's just a personal tip. It doesn't mean it's right or wrong. Don't set it in your diary. Try to get it back as soon as you can. So I've got, I think, 4 tips if I can remember. The first one is, and this happens in all writing, and I learned during my honours about writing a lot from an amazing supervisor who taught me a lot about writing, and it helps me every word in every manuscript and every grant that I write today. Sometimes in our writing, we open a can of worms without knowing it. To us, it's clear, but we've said something that's thrown the reviewer off. It could be a word, a sentence, a reference, and sometimes, this is actually one of the problems. So you're like, well, how could they say that? I've said it right there. And I've had this so many times. It's like, yeah, but there must be something we've said that's opened that can of worms for them. So we've got to shut that back down so that they don't go off in the wrong direction. So we want to avoid opening a can of worms in your writing and in your manuscript structure. So it might even be a heading. It's thrown them off completely. And so sometimes it can be simple to put those worms back in the can by just a simple tweak. So, that's, I think, a good strategy and a good tip to think about. Where possible, try to address the feedback rather than push back. As an editor, I really, it makes my work so much harder if they want to fight back. Now, it's okay to do that if you feel you need to, but the reviewer has had an issue with something. Now, so it is important to try and unpack that issue, because someone else might also have an issue. So, it may not be, but it can be isolated. So I'm not going to say you always have to, but I think typically you want to avoid it wherever you can. And so sometimes we have written things that we think are clear, but it's not clear to others. Try to stop and think about what that reviewer is asking. How have they missed? It was so obvious to us what that paragraph was talking about. But step back and try and think, oh gosh, how could I do this differently that the next person won't misinterpret what I wrote again? And then that might be a solution. You don't actually have to change analyses or change anything you've done. It might even just be a language thing. So I think I'll go on to that next point. Tip number 2 is, this is only me as well. No, this is an important point. Sorry, the next one is really only me. This is something that really I find very junior and novice, students and EMCRs make the mistake. The reviewer writes a question that says, I don't know, whatever it might be. It says, what about, and we might be doing a paper on cardiovascular disease, but we've written about Australian statistics, but we're submitting to a European journal. They might say, what about global statistics? Okay. So the idea of that question, in case you didn't realize this, is not for you to answer that question in the response. The answer is to build that response into the manuscript. So it's a lot of people just want to answer the reviewer's question in the response to the reviewer. As an editor, I am looking for that response to be answered within the manuscript. So we can come back to that, but that to me is probably a fundamental mistake that a lot of people make. You're not actually answering the reviewer. The reviewer is trying to tell you something they want in the manuscript moving forward so that other people don't have the same question. I'm not sure if that makes sense. Put a question if you want to come back to it. So these things need to be built into the manuscript so that other readers don't have the same concern. And although some questions are phrased as questions, they're not really questions as such. Please address this in the manuscript. I've just got an example of using text changes. Obviously, you don't have to look at anything of what's on that little image, but it's just an example of a big chunk of text added where they might have asked a series of questions, but then I've put a chunk of text in the manuscript in track changes to address those questions. The next point, this is in the response, and it goes with manuscripts as well, but this is in the response. The flip of that is, this is my opinion, and I don't like to see it as a reviewer. I know many people do it, and many novice people do it, but I don't need to or like seeing every word, so all of that read. I don't need to see that in the response personally. I want to know the guts of what you're saying. So I want to know, in the updated manuscript, we've included more global statistics, see page 1, paragraph 1. Then, because as the editor, I'm not going to take your word for it. I actually need to go to the manuscript anyway. Now, that could be different for some editors, but I check what you're saying in the manuscript. So I don't kind of need you to spit out a great big slab of text for me there in the response. So anyway, that's my personal strategy, my personal advice. I'm looking for clean, structured, tell me what you're doing to handle this response. I will then go to the manuscript to see whether that is what you've actually done. So that might be a point of contention, and there may be people that disagree, and that's okay. It's just, that's a strategy and what I look for as an editor. So I just wanted to show you again, of course, you don't have to look at any of the detail here, but I wanted to share an experience with my recent PhD graduate, Anna Singleton. And I don't know everyone that's on the call, but there might be some other authors on the call. Anna submitted a systematic review to the Journal of Clinical Oncology, which has an impact factor of 41 or something amazing. And anyway, we were very happy because we got major feedback. So major changes came back from this journal. For a student in an impact factor journal like that is amazing. But we got pretty tough feedback, which that's the other point. The higher the journal, the more tough the feedback's going to be, and the higher the benchmark's going to be. So that's okay. So we get complex feedback. And this did take Anna quite a long time to respond to, and we took our time, and we did get an extension because it's a major journal, very challenging feedback, and we want to do absolute best job we can because we got one shot at getting this over the line. So we get comments from this is just an example, we can look at it later as well, but we've got general comments from the editor. There's a whole bunch of comments I'm not going to put on here, but this is how we laid out this response, which was a challenging one about needing more analyses, and maybe a lot of questions about analyses and high-level analyses. We have a statistician on the team, but still we were sort of, okay, we need some more advice here. So we kind of made an overarching, this is for one of the points they made. We kind of made an overarching response. And what we did is we actually consulted other external support from another colleague who wasn't an author at the time, but we also added him as a co-author, who was an expert statistician in systematic reviews, including with the Cochrane group. So we told them, well, we've gone and got more help from a very senior statistician, very experienced in this area. Then I really liked how he handled this, which was raised by multiple reviewers, and this was probably the linchpin of getting it in or not. The other ones, I think the editor could take it or leave it, but the editor really, you could tell, really wanted to see a good response to this particular issue. So we really nutted it out very deeply. We had multiple calls. We shared this around multiple times, but we're very clear here. To address the issue of heterogeneity, we did several things. 1, we did this. 2, we did these things. 3, we did these things. So we gave them we wanted to really make it nice and easy for the editor to see, bang, bang, bang. I don't want all the reams and reams and reams of results as the editor, how it impacted the results or any of that. This was an early version, by the way, but I just wanted to make sure the editor gets what we've done to address the comments. So they're not really interested in what's the results. They shouldn't be. If this changes the results or not, it shouldn't impact peer review, because peer review shouldn't be impacted by the findings. So it was about process and science. Anyway, that was just an example of a very complicated one of how we handled it. This is my personal pet hate, and I'm sure all of you, I can see there's 140 people online. I'll be happy to know how many people do this. I'm guessing it's probably over 130 of the 140 of you. Everyone wants to try and be persuasive and say, oh, we thank you for those positive comments. Oh, thank you for that helpful comment every single time. In actual fact, I delete all of the positive comments from my responses, and I only tackle the actual comments they want responses to. The editors got those comments. They don't need to see that all of this. I really don't care at all as a reviewer for them to start telling me, oh, thank you. Anyway, that's a personal thing from me. I'm sure other supervisors may think differently. If your other supervisors think differently, at least keep it to a minimum, because it's very tedious, because it just wastes time. I just want to get in and know what you've done. So you also don't need to include all those general comments. Oh, this was a study and a blah, 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 and, it was good and blah, blah, blah. As the editor, again, I don't care about that. I want to know, what are you doing about the issues that the reviewers have raised? So personally, I get everyone to cut to the chase, and what are you doing about these things? And as I said, I'm looking for those simple, clear bullet points about what you've actually done in the manuscript to address the issues. Okay, I think we're going to change tactic now. So I'm sure you've got plenty of questions, and you might not agree with all of them, which is perfectly fine. So then I just want to shift the gear, so we've got some time to talk about grant peer review, which, as I said, is actually very different. And the couple of things I want to touch on here, that receiving peer review in terms of our grants is tough, very tough for all of us, including me, including junior people. And that's the first thing, number one thing I need to say. And not all schemes give feedback. Some give absolutely nothing. MRFF, you just get nothing, whether you get it or not. Some of them do some. Some you'll get scores, some you get comments, some you get all of the above, whatever. So, feedback can be helpful and can give ideas for improvement. But I'm going to give you a few tips on that in a minute as well. And remember, I think with grants, it's a little bit different in some other countries and other schemes, but in general, particularly in our big schemes, MRFF, ARC and HNMRC, we might get the responses. We know we were unsuccessful. We get that horrible email and we think, all right, well, I'll just respond to all of this and then I'll get it the next year. Well, unfortunately, it doesn't work that way, because it's a totally new scheme, totally new reviewers, and a year has passed. So your competition has changed what they're doing as well. So, and just another year doesn't necessarily mean you're going to get it. Other people might have accelerated on the home stretch and done additional things to you in the past year, and they could jump you. So it's not quite so straightforward. But remember, really, when you're peer reviewing, you are thinking about that person in relation to other people. So unfortunately, there are amazing people out there that we have to compete against, and we might not realize that. So I think, anyway, that's another whole conversation and another whole webinar. But I think when we get the feedback, we need to try, if we get any feedback, we need to try and dig deep, think creatively, and find some ways to try and improve it if we can. Now, it's a terrible visual I've put at the bottom, because it doesn't imply if you keep watering it, you'll get it, but I'll give you an example in a minute. And I think my other tip here is, take that and get advice from people who've never had anything to do with it, who've never looked at this before. Don't keep going back to the same old, same old. That's what I was saying the other day in the faculty. You need to go to new people, because that's how you really get challenged. And it's not unless you get challenged that you're actually going to get the money. That's the brutal truth of it in the competitive environment. So I guess I kind of wanted to make 2 points. One is, some things, unfortunately, or ideas need to be ditched. We think it's a great idea, but no one else does. Or the patients hate it, or, it's never going to be feasible. So, sometimes we've got to let go. So that's the first point. So we need to go back to the drawing board. We need to sit outside by the beach with a coffee and a notebook and try and think, how can I either do something totally different or really kind of revamp this whole thing? Might be the whole study design, might be the whole intervention. So that's a whole rethink. And I think we need to be willing to let go and think, if that one's never going to fly, it's okay. And it might be okay to move forward. And I was just going to share with you, I had a randomized controlled trial, one of the early applications I put in the old NHMRC project grant scheme. And it was a great grant, and it actually scored very well. And I would have loved to have put it in the next round, But unfortunately, the whole public health structure changed in terms of flu vaccinations. It's about flu vaccination. And at the time, the government then introduced exactly sort of the type of thing we were going to test without any evidence. So it was no longer ethically viable to do that project. And so we did do some more work in the space, but we've never been able to go back and do that RCT again. So that got completely ditched, or we've done some other things in the space. So of course, some other things can be revised, and that's obviously a better option. You might want to look at different schemes and whatnot. We can talk about that in the chat after. But you do need to do the work. You know, you can't just think, oh, I'm just going to band-aid this or that. You really need to dig deep. You need to invest the time. You need to have the tough conversations, even though we don't want to. We need to listen and look at what people are telling us. And we need to seek out that brutal and honest feedback. And I think that's my biggest learning. The grants I've done best on is when people have smashed me the most in terms of the feedback, and I've been able to take that on, and vice versa. When I've given very tough feedback, they've been the grants that have been most likely to be successful. So we do need to try and take on that feedback if we can, and target the areas of weakness. So I was just going to give you, I'm almost finished, but an example of my Quell study. It was actually ended up being the first major CIA NHMRC project that I had funded. I had fellowships, but not projects. And at first we come up with this study in primary care, you know, which was a really good project. And we submitted it to a partnership grant. And our first attempt, I didn't even make the panel. I won't go into the ins and outs of the partnership panel, but the first round you get cut, you don't go to panel. So it's a bit the old NFFC. And so I sought that advice. We dug deep. We talked to people. I changed the investigator structure. I added new partners, blah, blah, blah. And we spent a lot of time revamping it. And then I put it in again. And this time it made the panel. And here's my scores that we got. And we thought, well, still not good enough, but we've gone not too bad on the investigators. We've gone terrible on the influence. Really, the partnership and the quality science, they haven't really liked it. So again, but this time you get this in a partnership grant plus some written feedback. So then again, go through that whole process. I mean, I didn't know how to make it better, but dig deep to really push myself to the limit of what I felt I could really do, I guess, which I did. And then we went again, we added more PHNs, we improved the background, got the story a bit tighter, got a bit cleaner. And then that time we got much better scores the year later, and it was funded, and that study has continued and led to many other amazing things. So that's a good news story. It doesn't always go like that. But I think my learning was really I did have to dig deep. It's not a matter of just re-putting it in again. It's really working on going hard to improve it. So I do just want to end on something that could be a whole nother workshop, and it's about coping with feedback, because if you can't cope with it, you can't manage it and you can't improve what you're doing. Unfortunately, in academia, it's part of the landscape. It's critical to what we do, and it's just par for the course. We've all been in tears. I've lost it myself many times. I've been frustrated. It's tough, as I said, it's very tough. And we do need to be kind to ourselves and look after ourselves, and we do need to give it time to process and digest. I do want to share with you my colleague, Professor Robin Gallagher, who's in nursing, 3-day rule that she always reminds me when I start, or when something goes haywire. So this is Robin's 3-day rule. The first day, you're allowed to sulk, you're allowed to wallow, you're allowed to cry, you're allowed to be disillusioned. I'm going to give up. Why am I doing this? It's all terrible. She says then on the second day, you're allowed to be angry. This is so unfair. Why did they get it and I didn't get it? Whatever the case. And then on day 3, you've got to try and let it go and move forward. And I guess the concept here, that, as Robin would say, it is about, it's okay to be disappointed. It's okay to be upset. In fact, it's important you allow yourself to be, because you won't be able to respond if you don't. And then as you move forward, you can kind of let yourself think, oh, okay, maybe they do have a point there. And that's really important, because psychology would tell us if you don't recognize the problem, you can't make any improvements. So there's where that moving forward and I guess the coping is absolutely critical. And it is something we never learn, we never touch on, but it's actually something I'm quite passionate about. And people in my team, I've had them speak, Stephanie Partridge, to the team about how do you cope with all this feedback and how do you manage it when it goes good and bad. And I think we just sadly have to be, rejection is out there all the time. Many times you'll get rejected from journals, from grants, from fellowships and scholarships. And you know, we all do have to try to work together to normalize it. I was just on a Heart Foundation panel last night. You know, we're looking at somewhere from 6 to 8% of the early career researchers ending up getting them, which is so unfortunate, but it's just all the money that's available. So it's just the reality that 93% of the people are going to be disappointed. But as a panel member, I'm very conscious of it and very mindful of those people who have given everything on that paper. So that's all I really want to say. I probably talked too much. Sorry if it's a bit too overwhelming and two quite different topics. I'll stop sharing my screen and hope you will put some stuff in the chat. You've got a little bit of my time, so please feel free to use it up. Happy to have challenging, easy, and whatever questions you like as well.
So much, Julie. That was an amazing presentation, and I'm sure I speak for everyone when I say how much we appreciate your time, and also the use of real life examples. I think they're always the best way to get a handle on these things, and you know, hear about rejection and hear about challenges, and it's realize that it's not something that goes away as you progress through your career. It's always there. So yeah, we've had some questions. I'll start reading through some of them. So feel free to put more of the Q&A. We'll get through as many as we can. So we've got one here from William Coquet. He says, I recently had a paper reviewed which got some feedback, but overall seemed positive. The editor only had one point they wanted adjusted, but the reviewers had a decent. Is it more? More important in the editor than the reviewer feedback?
Okay, I'm going to say that's a really, really good question. So I'll speak as an editor. So what we do, we would aim for, in my journals, we would aim for 3 reviewers if we can. So I will let those go. When I get them back, I look at each of those reviews and I look at the manuscript myself. I then weigh up, you know, those comments. And if I have a concern or a theme, something consistent across reviewers, I will flag that as my suggestion of what I want them to do. So, you know, that's kind of the reality is it's going to be the editor that you need to get over the line. So they're trying to draw together for you probably the clincher, a bit like the example I gave you. This is your real clinch point. You're really going to have to tell me how you answer. The other stuff I'm not as worried about, but have a crack at it kind of thing. So I get it that they're a bit picky and I probably might not care so much, but I do care about my point. So to answer your question, yes, you do need to really think well about anything the editor asks you to do, because they are ultimately going to be the ones who are going to click yes or no. And, you know, try to handle the rest of it. And the picky ones, I still think you should try to address those things wherever possible. So I'm not sure if that answers the question, but absolutely, that means that's a clinch thing you need to do, basically.
Great, thanks for that. That was really good. Great question. One here from Tian Wang, and there's been a few along this.
Yep. Standard.
How to disagree with the reviewers politely.
Yeah, so I mean, look, it's a good one. I, on 90% of occasions, try to avoid it at all costs. If it's absolute, so it's easy. If one reviewer says one and one says the other, you can sort of align with, obviously, and you can say, look, that reviewer said that, we've opted to go this way. I would try to use other literature if I'm going to disagree. So they might have misquoted a guideline or a systematic review. You know, we know from X, Y, and Z systematic reviews that, you know, this tablet lowers blood pressure. Therefore, that's why we've chosen to go with that particular tablet. But as I said to you before, it's also about making sure that that is clear in the manuscript. It is not only about answering it. If you're answering it politely, you need to also look at your manuscript and make sure you've made that point about that blood pressure medication. So what you might do is a strategy, if I say, they're not happy with the blood pressure medication or something in my paper. So I'll say, look, X, Y, and Z evidence shows that particular medication is appropriate to use. So what you might do is go back into your manuscript though, and you might clear that up. So you might have been a bit ambiguous, or you might not have put strong argument for that medication. You might be able to go back into your manuscript and say, in response to the comment, we've gone back and clarified exactly why we've chosen that tablet based on the evidence. So you try to, I guess, rather than tell the reviewers not right, try and rephrase things in your manuscript so that is more clear as to why you've gone that way. I'm not sure if that's the tactic I would typically try to use. If I disagree, or you can't do something, you can't recruit another 50 people, you just have to put it in a limitation. You didn't recruit enough women, you'll just have to put it in a limitation, and you might address it that way. So try to find other constructive ways that it improves the clarity of your manuscript, whether or not it actually does exactly what they want you to do, but it might clarify the issue.
Yeah, I think that's really good advice. I think, yeah, in my experience, it's always better to acknowledge what they've said and then focus on why what you've done is correct, rather than what they're suggesting is wrong.
And I think that usually I find it's that can of worms thing. We haven't made something clear. We can make it more clear, and then the next person won't have the same issue often, not always. So I really try to avoid it. I really don't like it. I'll give you an example of on Nature just last week. One of my statistician reviewers was not happy with the confounders that had been used in the analysis. Now, this was a statistician, and she wasn't happy with the confounders the authors have used. We sent it back to the authors. It was her key point. She wasn't happy that it was too biased because they hadn't handled these confounders. The reviewers came back. They did not address her comment. They did not address that they were confounders, and we rejected the manuscript. Last week in the Nature Journal, they were asked to address the confounders. They refused to do it, and they got rejected because we felt that was the clinch point for the bias in their paper. So I guess do it at your peril as well. It's not a good idea to outright reject comments. It's rare that the people have completely ridiculous comments, and that we can't do something to improve at least the clarity of what we've done.
Yeah, no, that's really good. So another question here from Angela Todd kind of flows on from that. How much of a review, whether manuscript or grant application, falls to the randomness of the reviewers? So as an editor, you've seen tough reviewers. Do you ever give reviewers feedback as an editor?
Yeah, that's a good question. So reviewers' feedback, Angela, yes, we have a program at Heart, Lung and Circulation where we support them, some of the junior reviewers in particular, and we will talk things through and give them feedback. And as a reviewer, you can ask, you can always get feedback on how you're going from your own supervisors as well. So I agree, that's really important. And another way you can do it is you usually get an email as a reviewer back to say whether they rejected it or not. And it's not all journals, but sometimes what the other reviewers said. So it's quite good to have a bit of a look at what the other reviewers thought of it, and see where you sat in relation to where they sat. And as the editor, just remember, that's what I've said when it's like how to do a peer review is, as the editor, I might have a statistician, I've got a clinician, and I've got a scientist, something else, reviewing this. And I'm looking at the breadth of what everybody's told me. So each one might be handling something different. What was the first part of the question was about, oh my gosh.
Reviewers, like, do you find, you may get 3 reviewers.
Oh yeah, discrepancy kind of between reviewers. Interesting point. I was only having a discussion with someone the other day, and I've reviewed many, probably 1,000 Cat 1 grants. And I've applied for many have been rejected, many have been successful, thank goodness. I've supported people. And I reckon I can call it 75 to 80% which ones are really likely to get funded. And at the moment, I reckon I'm on 80 or 90% success rate, looking at it and knowing which ones are going to get funded, particularly grads. So it doesn't, but there is a level of randomness. I think right at the cut point, yes. And I think we've been going through this with investigator grads, Ollie J, myself, and Sarah Lewis with our initiatives last year. Yes, there's randomness, but in a good grad, you're trying to reduce the chance of randomness. So you're trying to make it appealing to everyone. And so there's a whole bunch of strategies to doing that. But yes, there is an element of randomness. In terms of the reviewers on a paper, yes, there is. But as an editor, we try to do at least 3. Sometimes there's 5, sometimes there's 2, and I will review it myself. So, you sort of get that package. And so I guess to the previous point, 1 or 2 random comments by reviewer number 3, a good editor, it's okay. They're not so fussed about that, actually. But if you can handle it, that's good. So, yeah, I think randomness less in a paper. I'm less and less convinced about the randomness, to be honest. I think it's only at the cut point. But I know we want to think it's random because we think, oh, but my application was amazing. It's only because some silly reviewer didn't. But then I supported many people, and Ollie and I did much time with many people who were unsuccessful with investigator grants in the Faculty of Medicine and Health last year. And we could almost pick exactly the scores they got and why.
So something following on from that. Have you ever, as an editor, had a case where there's, one review amongst a number that sticks out? Have you ever had the person actually come back and say, and write to you directly as the editor and say, I'm not sure how to address this reviewer because this comment just seems so left? Good question,
and the answer is no. We have done it before. I can't remember when I've done it. I've almost done that myself. So what I can't think of the exact specifics. But we, in our response, have actually said we're a bit unclear regarding exactly what this reviewer is asking. We're thinking it might be this, but we're happy to get advice from the editor as to what you think. We've done that before. So we've but not by an email, in the response letter, fold that in. This is what we're thinking they're saying, but acknowledging we're not 100% sure. So, kind of seeking, we could do it a different way if we've misinterpreted. So you're kind of hedging your bets back to the editor, because the editor's then going to look through that and they might come back to you again yet. So big journals, you'll be going backward and forward 5 and 6 times. So that's the strategy for that. I wouldn't email anyone directly.
That's good advice. Another question here from Leah Marks. So for peer-reviewed publications, I've encountered reviewers who pose comments instead of or in addition to clear feedback and questions, sometimes not with clear implications for the paper. So how do you interpret and deal with broad commentary from the reviewers?
Yeah, I think broad commentary, you have to treat it as questions. So you do have to broad commentary that's positive, who cares? That's fine. But the negative kind of commentary is important. They're not specifically saying, can you do X? They're saying to you, you need to try and make this clearer, or you need to try and explain this better. So you need to address it as a comment and say, look, they're thinking that, we've clarified this, that, and the other. And we hope that helps make the matter more clear, because that may well go back to them and they'll want to see that you folded in their thoughts. So they're doing a bit of different thoughts in the manuscript. Ultimately, you still have to try and consider all of their thoughts.
Okay, we've got one here that's slightly off topic, but highly relevant to a lot of the community that would be here today. So Laura asks, are the responses to the examiners of a PhD thesis similar in terms of being concise?
Yep. Yeah, and another thing I thought of is ethics. So ethics responses is a very similar tactic as well. The last thing you want to do is say no, if you can avoid it, you want to show the ethics committee how you're handling it. But yeah, absolutely, responding in a thesis is exactly the same, basically, yes. I think Sarah's written a comment, Sarah Rhodes, about how do you normalize rejection. And I think this is something, there is movement towards trying to do this. Certainly within my group, you want to praise people for putting things things in and for getting feedback, and you want to say, oh, it was fantastic, we had all these people, put it in and all did amazing work to do it. Unfortunately, one's, got up. So we need to keep highlighting how many are missing out and how amazing those people are as well, especially in the current funding environment. So it's a tricky one. You'll notice on Twitter a lot of people are doing this, which is good. And in the faculty, I told them I wanted an email going out that it's okay, you're good, you're important to us, no matter what that result says. So I don't know, but having conversations like this that didn't exist when I was, coming through. Okay, so yeah, you go.
Okay. Time for a few more. So Christina asks if the reviewer feedback is not in bullet points, but more of a narrative, should we be converting it?
Yep, I convert it to bullet points, yes. So I would group things into bullet points. And if they've asked one bullet point with 3 questions, I'll split that out into separate bullet points. I think it's much easier for the editor, because as the editor, I've got little time. So what I want to see is, bang, they've done this, bang, they've done that, bang, they've done that, good, 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 tick, 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 check the manuscript, tick, tick, tick. I'm more likely to go, yeah, good, accept. So that's what you want. Yes.
Same as the manuscript itself, you want to make it as readable as possible. So if they've given you a slab of text, split it up, make it very easy for. So yeah, you'd accept. Question from Natasha here. Loving this presentation. Thank you, Julie. I'm currently drafting a paper and would love to present all the amazing data. But I realise it might be possible. Any advice on what data to present?
Yeah, look, I mean, trick for young players, and same in grants. Everyone wants to jam everything in, and I think in the current status of grants, it's as much about what you don't put in as what you do put in, and being really careful with that. No, don't put all the data in. Don't put every word of every number of everything you collected. But keep it succinct. The trick is to keep it to the aims as well. Go back and challenge yourself. What were the aims of this paper? The aims of this paper weren't to produce 50 million tables. The aims were to answer a couple of questions or a couple of aims. So, I guess that's always where I tell everybody to go. Go back to the aims of what you were doing and make sure that your data and your results speak to those aims. And really, you don't need to add fluff around them. Obviously, you've then got supplementary material and tables to put in. I typically don't like to put too much in. I just feel like that's people just wanting to jam more to show how good they are. But it's not really answering their question. But it might be like a sensitivity analysis that maybe was not significant or something. Well, you just can put a sentence that we did this, and we found this, and it showed no difference. But if you want to put more data, obviously you've got the supplementary materials or appendices, that sort of thing. But go back to the aims, think carefully. A table full of insignificant things can often be written in a few sentences of text with numbers as well.
That's great. Okay, well, we've got time for a couple more. There's one here. After a rejection, is it advisable to include the previous journal's peer review comments and responses along with notification?
No, definitely not. So if you get rejected, you should look at that feedback and you should try to think about, can I improve some of these things or not? And then if you can, you just do it and you just submit it fresh again. Don't give them ideas about what they might critique. Just give them it fresh. But you might have incorporated some of that stuff. Depending on which way you go, as I said, it's probably really important to remember the higher the journal, the harder it is to get in. I think it's the reality. So you go to a big impact journal, it's much harder than a low impact journal. So you're going to be scrutinized much more. So you might have gone down the chain and then you might sort of get through a little bit more easily, and then they turn a bit more of a blind eye to something. So no, definitely do not mention previous reviews or previous feedback.
Another one here from Antonia that touches on a few things we've talked about. If the reviewer wants you to use outdated terminology, how can you respond to that politely?
Again, I think that's like what we said at the start. I think I would just, again, refer to the literature and try to say, we've chosen this term digital health because of this reason, you know, maybe another version, internet or something, you know, now this is the commonly used term in X, Y, and Z guideline or, you know, policy document or whatever. And so we've chosen to go with that particular term. A concept like that isn't going to get you rejected or accepted by an editor. As long as you've made a reasonable, so try to justify why. I think that's always the point. And then if you think, yeah, you know what, they have got a point, you might change it in the manuscript. But if you feel strongly and that's the accepted term in guidelines and whatever else, then go with that and give the evidence as to why. And you might even clarify that in the start of the manuscript. So in the opening, in the context or somewhere, you might say, we've chosen to use this term to represent these things in line with current guidelines. Reference. And then in response to the comment box, you can say, yeah, and we've clarified that and made that clear that why we've chosen that term in the manuscript. Yeah. It's one sentence. Rather than, no, we've chosen this because we think this is better. You know, it's a much nicer way of handling it, I think.
Yeah, definitely. And you've got to trust that the editor, if it is as clear,
they're not going to reject on something like that anyway.
Exactly. Excellent. Okay, well, we're out of time.
Glad to see so many comments in there, and that's exciting. So many people online and engaging. Hope I can help in any way.
Yeah, no, we really appreciate your time. And as I say, the examples you've brought today have really been illuminating and just normalizing as well. I think it's really important. You know, these topics don't get talked about enough, and you know, there's obviously been a lot of interest, so we really appreciate that. And
no problem.
Thanks everyone for attending.
Join the network and look forward to more stuff.
Yeah, definitely. So there's a QR code on the screen there. If you'd like to just take a couple of minutes now before you forget it gets shoved down the pile of things you won't bother with, just to give us a bit of feedback about today's webinar. We really appreciate that. And yeah, thanks for coming. And yeah, hope you got something out of it. I certainly did. And yeah, enjoy the rest of your day.
Thanks, guys.
Thank you so much, Julie.
Oh, no worries. I hope that was what you wanted me to talk about.
100%.
Oh, okay.
Thank you so much.
Good attendance. Have you had one? Did you say this is the first one?
This year, yes, this is the first one.
Okay, well, you've got good engagement with your network, so congratulations.
Yeah, thank you.
And you know, I think with all of these things, listening to what people want is the most important thing. How can we help you? You know, what are things you need help with? Not what do we as academics or whatever think everyone needs help with.